All right, welcome to our explainer. Today, we are diving deep into the invisible forces that control pretty much everything you do. Every thought, every movement, every single heartbeat. We're talking about the body electric. It's this incredible world that's run by tiny charged particles of salt, where just a few molecules out of place, well, that can be the difference between life and death.
So let's just jump right in. We're not starting in a textbook, we're in the emergency room with a real medical mystery. We've got a 62-year-old woman and she's having seizures. Now, the big clue is right there on the slide. Her blood sodium is way down at 114. And just so you know, the normal, happy range is about 135 to 145. So how on earth can a little bit of missing salt cause something this serious? To figure that out, we have got to meet the main character in our story.
And yeah, you guessed it, that main character is sodium. It's so much more than just the stuff in your salt shaker. Honestly, it's one of the absolute pillars of our physiology.
So meet sodium, the undisputed boss of all the fluid in your body. It's the main positively charged ion, or what scientists call a cation, that's floating around outside of your cells. And it has one super important job. Tell water where to go. The rule is dead simple. Wherever sodium goes, water has to follow. So in a way, sodium is the director of our entire internal ocean.
Now this is where it gets really cool. Look at the sheer scale of the imbalance that your body works so hard to maintain. Outside your cells, you've got a sodium concentration of about 140, but inside, it's a tiny 10. That is a 14-fold difference. This massive gradient is like a dam holding back a huge amount of potential energy, and the body taps into that energy for, well, pretty much everything, from firing a nerve signal to making a muscle contract.
So you might be wondering, how does the body pull this off? Well, the design is just brilliant. It uses two totally separate but connected systems. First, you've got the concentration controller. That's a hormone called ADH. Think of ADH as controlling the water tap. It fine-tunes the sodium concentration by deciding how much water to add to the mix. Then you've got the total amount controller. This is a whole pathway called RAS, and it acts more like a bouncer at a club, managing the total amount of sodium that's allowed to be in the body.
Let's take a closer look at that RAS system because it's just fantastic. You can think of it as the body's emergency volume up button. Let's say you get dehydrated on a hot day. Your blood volume drops. Tiny little sensors in your arteries and kidneys detect that drop, and they sound the alarm. This triggers the kidneys to release a substance called renin. Renin kicks off this whole chain reaction of hormones that you see here, and it all ends with aldosterone basically screaming at the kidneys, hold on to every last bit of sodium and water you can. And just like that, blood volume is restored.
And boom! This brings us right back to our first medical mystery. When our patient's sodium level dropped all the way down to 114, the water outside her brain cells had nowhere to go but inside them, trying to balance things out. This rush of water caused her brain cells to swell up, a condition we call cerebral edema. And that swelling is exactly what leads to confusion and, in a severe case like hers, seizures.
But here's the thing. Sodium isn't the only electrolyte with this kind of life or death power. Sodium manages the fluid, right? Well, its chemical cousin, potassium, it manages the electricity. So let's check out another case.
Okay, puzzle number 2. We have an 82-year-old patient, and her blood potassium is 6.3. Now for context, the normal range is really narrow, just 3.5 to 5.0. That number, 6.3, it might not look all that high, but trust me, in the world of potassium, that is a 5-alarm fire. It is a true medical emergency that could literally stop her heart.
And here is exactly why doctors panic. That tiny shift in potassium creates a massive electrical storm in the heart. And you can see it immediately on an ECG, which is the electrical tracing of the heartbeat. You get these tall, pointy, tent-like waves called peaked T waves. This is the classic scary warning sign that the heart's electrical system is unstable and getting dangerously close to a fatal rhythm. This whole problem comes down to something called membrane potential. So if sodium is the director of fluid, then potassium, as you can see, is the manager of electricity. It's the main ion that determines the electrical charge across the membrane of every single nerve and muscle cell. Think of it as setting the readiness of the cell to fire an impulse. Too much potassium outside the cell messes up that delicate ratio, and it makes the cells dangerously overexcitable, which in the heart leads to pure electrical chaos.
And the reason this system is so unbelievably sensitive is right here on this chart.
A whopping 98% of all the potassium in your body is kept safely locked away inside your cells. That means only a tiny 2% is left floating around in your blood. So you can see why even a small leak from that massive indoor reservoir can cause the outside concentration to just skyrocket and trigger the kind of emergency we just talked about.
So we've got these two super powerful ions, sodium for volume, potassium for electricity. But who's the mastermind pulling all the strings? Who's making sure these levels stay within those razor-thin margins needed for survival? Well, let's meet the master regulator.
It all happens inside your kidneys, and the story starts with this one number, 125 milliliters per minute. That's what we call the glomerular filtration rate, or GFR. It's the amount of plasma the kidneys filter out of your blood every single minute.
Now, I know, 125 milliliters a minute might not sound like a whole lot, but let's scale that up for a day. That comes out to filtering 180 liters of plasma every single day. To give you some perspective, that's like your body's entire plasma volume, all of it, passing through these two little bean-shaped organs 60 times a day. Incredible.
But here's where the real magic happens. This is the kidney's greatest trick. After filtering that massive 180 liters, they meticulously reabsorb over 99% of it. They put back the exact right amount of water, sodium, potassium, everything to keep your internal environment absolutely perfect. The urine you produce, that's just the tiny 1% left over that your body didn't need. So what happens when this incredible organ fails? We call it acute kidney injury, or AKI. And to figure out what's going on, we basically classify the cause based on where the problem is. Is it a pre-renal issue, meaning not enough blood is getting to the kidneys in the first place? Is it an intrinsic problem, something wrong inside the kidney's filtering machinery? Or is it post-renal, like a blockage that's stopping urine from getting out?
And what's really cool, as this slide shows, is that we can play detective just by looking at the chemistry of the urine. If it's a pre-renal problem, the kidney is actually healthy. It's just starving for blood. So it does its job perfectly. It holds on to almost all the sodium and water it can, which makes the urine super concentrated. But in an intrinsic injury, the kidney itself is broken. It can't reabsorb anything properly, so it just leaks sodium and water, and you end up with really dilute urine.
But the kidney's job goes even deeper than just salt and water. It plays this crucial, slow and steady role in the body's ultimate balancing act, managing acid. And this isn't some minor side gig. It is a constant, life-or-death effort.
You know, your body keeps your blood pH in this ridiculously narrow range of 7.35 to 7.43. Drifting even a little bit outside that is a catastrophe. And this is all thanks to a beautiful partnership. You've got the lungs, which act fast. They can balance CO2, which is a type of acid, in a matter of minutes, just by changing how fast you breathe. But then you've got the kidneys. They're the slow, powerful, long-term regulators. Over hours and days, they are meticulously managing bicarbonate and getting rid of acid to keep that balance absolutely perfect.
Okay, so after that lightning-fast tour of our internal fluid and electrical systems, what are the absolute key points, the things you really need to remember from all this? Here it is, your cheat sheet. When you think sodium, think volume, and when it's out of whack, you get brain problems. When you think potassium, think electrical excitability, and when that's out of whack, you get heart problems. And running the whole show is the kidney, the master regulator. But the biggest takeaway of all is that our bodies exist in this unbelievably delicate balance, where the tiniest chemical changes can have absolutely massive consequences.
And so we'll leave you with this thought. These invisible little ions, all managed by organs we never even think about, are the silent guardians of our very existence. The line between having a normal day and having a medical catastrophe, it's not a line at all, it's a razor's edge, and it's measured in millimoles. It's just a profound reminder of the quiet, constant, and pretty shocking fragility of the body electric.